Knowing the People Planning, KPP, is a practical approach that assists mental health services plan for and meet the needs of long-term service users.
This approach is designed to promote service user recovery, improve service provision, quality and efficiency. We know that 10 district health boards were using KPP. This year, there are additional 3 that are being assisted, and 2 pilots have started with NGOs. The evidence we have of those DHBs that are using KPP indicates a remarkable reduction in average length of stay and bed day use.
It was a pleasure to hear all the things the Minister was saying this morning, because he mentioned KPP, knowing the people planning, which is something we've been passionate about and doing for quite a while in Hawke's Bay. So it's great to see the Ministry are supporting that and are behind that, because we believe it's a really good tool that can be used at an individual and team level to make things better for people who use our services.
So they've collected the information about service users in terms of their employment status, their GP status, in terms of how much acute beds they've used. And what he was able to show through the use of this really simple tool, KPP, was how much it had actually improved people's lives.
And in New Zealand, if you look at people who've been in contact with services for 2 years or more, it's about 15,000 of that order. The question then becomes the needs. And so nobody could tell us what the needs were. So we went and asked people who use the services, their families and whānau. They gave us these 10 key features, whether or not they've got a treatment plan, a relapse prevention plan, which is very important to help people remain well, and what to do if they become unwell to re-enter the service, whether they've got the right kind of appropriate medication, whether they've got a GP to be referred back to, whether they've got a home and a job. Now it's possible, and we've done it for hundreds and hundreds of people, to collect that information and keep it up to date on a daily basis.
So some of the early observations we found when we started looking at mental health services was the significant variation in acute bed use, particularly on the South Island. And we also found that long-term clients were unknown and information systems couldn't tell services anything about the long-term clients.
What we've done with Interpo is we've turned it into this really cool spreadsheet. People that have been in the service for more than 2 years, they really easily describe their needs, whether people would like to address employment, their accommodation, whether their medication needs changing, whether they've got a GP. Things like accommodation that didn't turn out to be the issue that they thought it was. So the data actually showed really nicely that they didn't need to invest huge amounts in addressing a problem that actually people weren't having. So it's really focuses caseworkers or key workers within services on some really basic needs, but that make a huge difference in people's lives. Carolyn Swanson, who works as Depot as a service user leader, presented on the value of KPP to service users, and the key points that she really reiterated was the way in which it really supported engagement and enabled people to really take control of their own lives. So from having hundreds of people being in the service anywhere up to 15 years, they'd really reversed that trend so that most people were leaving the service within 1 to 2 years.
Ultimately, the collection and the use of this information is going to improve and has improved the quality of the services that we provide to consumers. And one of the things that we're trying to get clinicians to consider is that if I capture some information about a consumer, if they give me some material, I've really got a responsibility to discuss that with the consumer. Ultimately, the collection and the use of this information is going to improve and has improved the quality of the services that we provide to consumers.